Is it time for Botox or facelift? What's the best time to go surgical? Dr. Ennis Plastic Surgery in Boca Raton, Florida. So what's the best time to transition from Botox and fillers to surgery? Well, you have to look back and realize what's changing. Is it 30? Is it 40? Is it 50? Well, what starts to change in our late 20s, early 30s, even into the 40s is the muscles and ligaments of the face. So the way I describe the patient, we have lots and lots of tools in our tool chest. They all do different things. At one end of the spectrum is all the Botox and fillers and lasers and chemical peels. They do a great job at fixing the skin quality, brown spots, fine lines, and wrinkles. Surgery, on the other hand, fixes structural parts. So when you're 25, 30, 40 years old, all the fine lines and wrinkles are great, but don't let somebody convince you that the fillers, the Botox, the end-all be-all, and they're going to last you forever. Because what happens if you go to a non-surgeon, these places only offer Botox and fillers. So what do they give you? Botox and fillers. There's going to be a point at which you need to transition from the Botox and fillers to the surgical side of the equation. Depends on what we're looking at. Somewhere around the eyes, we look at 38, 40, 42. That's why a lot of people come in. They start to notice some bags on their eyes. The brows got a little low. Botox and fillers are great for a while. Yes, you can get a little chemical brow lift out of Botox when you're 28, 30, maybe 35. There's going to be a point where you feel like your brow's getting heavy. Every time you get Botox, and well, I don't like Botox anymore because it makes my brow heavy. Well, it's really not the Botox that's doing it. It's the person that injected your Botox didn't recognize the fact that you're getting older, your brow's getting heavy, and it's time to transition over to doing a brow lift and not as much Botox. Same thing with the fillers. For a while, you can fill the cheeks, you can fill the tear trough. There's going to be a point at which they put so much filler there as their cheeks are going to look overdone. You need to transition away from the fillers and go to the lower blepharoplasty or surgical surgical procedure where you can take the fat out, raise the cheek back up, pad back up, and fix the surgical part of things, fix the structural part. What about down here? Well, yes, the old therapies and the lasers and the skin tightening, all those things are great when you're young. There's going to be a point at which the muscles and ligaments of the face get tired. They're going to droop and sag, and those procedures aren't going to work anymore. You need transition to the surgery side of things. Done facelifts as young as 28, 30 years old, but those girls needed it. Those guys needed it. They came in, that this was already drooping inside and thin. There's no fat. You got to tighten the muscles up. So again, it's not about not about how old you are, but really when you need it. Sometimes it's 30, sometimes it's 40, sometimes it's 50. There'll be a point at which you see these things are no longer working. The non-surgical things are no longer working. We need to transition and fix the structural parts. So when you transfer from one side to the other is when you see it, when you see the structural parts changing. So be careful on how much Botox and fillers are great tools. They do a great job at fixing certain things, but there's going to be a point at which you need to transition to fix the structural problems. When your brow starts getting low, when you get a little puffiness in your eyes, when your cheek pad descends, when you start to get the jowls and the platysmal band show up, stop doing all those things and say, look, I really need to investigate the other side of the equation and look at some surgical options. Once I fix those things, we'll go back and plug the Botox and fillers back in, but we've got to address the structural parts now and then transition back over to the other side later.